Hi guys, so I'm going to break this video probably into two bits or two parts, and it's a follow-on from the cardiac video that we had last week. So we discussed about chest pain and the importance of going to hospital. So I just want to follow that on. So what happens next if when you call the ambulance and you're waiting on the ambulance to come, or if you've delayed and you're with someone and they go into cardiac arrest? So a couple of things that happens, and I'm particularly talking about a witnessed cardiac arrest here. A couple of things that happens in a witnessed cardiac arrest that may stop you starting CPR. So the first one is called the fencing reflex. It kind of comes from when we were babies. It's called the ATNR, or the asymmetrical tonic neck reflex. It's when babies sleep with their arm above their head and they're twisted, and it looks like a fencing kind of reflex. And when you have kind of any type of head trauma or a sudden stoppage of a blood flow and oxygen to your brain, you go for a small period of time, maybe 30 seconds to 40 seconds, you go into what's called the fencing effect. And the fencing effect is when your hands spasm and start to come up above your head like this. And it can be a cause for people not to start CPR because they think the body is having a movement and the person is still alive, and that's not the fact. The fact is that there's no blood going to the higher cortex part of the brain, and the brain is causing a spasm, particularly into the limbs, and an activation of this asymmetrical tonic neck reflex is what it's called. The second thing that happens is the body, because it's not getting enough oxygen, starts these kind of dying gasps. So they're called agonal breaths. So a normal person in their normal state breathes between 12 and 20 times per minute, and they'll have good chest rise, so you'll see their chest rise. In agonal breaths, all you get is movement of the jaw, maybe some movement of the throat, a small movement in the chest, but you certainly don't get 12 breaths per minute with good chest rise, and they're called agonal breaths, and that should not stop you from doing or starting CPR. So it's really important that the CPR starts ASAP, because time is tissue when it comes to the heart. And you know, when you originally go into what's called ventricular fibrillation, or your heart goes into spasm and stops, you have about 3 minutes or so without oxygen before you're going to be in a serious kind of neurological deficit, or your brain tissue is going to start dying. And you have about 7 minutes before you become what we call biologically dead. But in between that 3 minutes and 7 minute window, if nothing's being done, it's quite hard to get any type of return of spontaneous circulation and a person back to life, and to be able to leave hospital with good neurological function. So which is what we want at the end of the day. We want someone to be saved and be able to continue on with their life. So they're the things, the fencing reflex where people's arms move, and the agonal breaths, they're things that stop people initially starting CPR, and they end up putting them in the recovery position because they think they're still alive. And then when the ambulance service gets there, or we get there, you're kind of, the person meets you at the door and he says, yeah, we put them in the recovery position and they were okay and they were breathing, and when we go in, they've been dead for 5-10 minutes, and you know, too much time is lost. The other thing that may happen during CPR is you may get some vomit coming out of the mouth, and it's not reaction driven or diaphragm driven vomit. It's just where there's been air pumped into the stomach as opposed to the lungs. You get some distension or air in the stomach, put some pressure, and it pushes anything in your stomach back up through your mouth, and the person's not getting sick, there's just fluid losing their mouth. So you just need to clean them out and continue on with the CPR. And that again can cause people to think, oh, they're getting sick, so you know there's something happening, and they can stop and put them in the recovery position. And the last thing that stops people doing CPR is the actual unpleasant stuff that people don't like talking about in first aid classes. The smell, your body's not functioning properly, nothing's holding anything in, so both ends are inclined to, or possibly you get some smell, you get some vomit in the mouth. It's a traumatic experience, and it's quite a violent act to watch happening, someone doing compressions on someone's chest. So all in all, it can be, especially if it's your first time and you're not particularly trained or experienced in it, it can be a traumatic kind of experience. But it is absolutely essential that CPR starts ASAP and defibrillation as soon as possible. So that's the next part of the video I'm going to talk to you about. I'm going to talk you through CPR and defibrillation. Okay, thanks for that, guys.